prevention has always been better than cure. But in the current crazy life stresses that we have, preventive health screening has become extremely more important than ever before. So today's topic of discussion is on preventive health screening of men and women. Now, some tests are common to both men and women. For example, a complete blood count, a CBC, can detect leukemia, blood cancer, can detect septicemia, which is severe infections, can detect anemia in both ladies and gents. Preventive health screening for diabetes involves checking of fasting blood sugar, post-lunch blood sugar, 2 hours post-lunch blood sugar, and glycosylated hemoglobin. This again is for both ladies and gents. There is a value called a blood test called serum creatinine, which detects kidney disease. Now, believe it or not, you can have 90% of the kidneys destroyed, have only 10% kidney function left, and the patient can be totally asymptomatic. So, creatinine of less than 1 is a normal value, but we have seen patients walk into the clinic with absolutely no symptoms and a creatinine of 7 and 8. So, creatinine estimation is one of the most important preventive health screening checkups. The other one which we do is for the heart, 2D echo, exercise stress test, and nowadays a very popular test called CT coronary angiogram. A 2D echo detects heart muscle problems and valvular problems, whereas a stress test detects blockages in the arteries going to the heart, but it's an indirect test. So CT coronary angiogram has become popular because it tells us exactly how much is the blockage, in which artery, and it is quick. It takes less than 5 minutes and it's very accurate, especially with the newer machines that we have in this hospital. A simple test like X-ray chest, for example, done in men or women, can detect pneumonias, pleural effusions, and even lung cancers. Ultrasound of the abdomen done in men and women can detect things like gallstones, pancreatic issues, liver problems, and specific to ladies are an ultrasound of the pelvis, which shows us ovaries and uterus. For men, it shows us prostate. There are specific tests for men and women. For example, prostate-specific antigen is a blood test we do only in men because it detects cancer of the prostate. Prostate gland is below the kidney only in men. So this is a very important test that everybody, every male should have after the age of 40. MRI of the prostate, which is being done recently, and an ultrasound of the prostate is equally important to detect either enlargement of the prostate or even cancer of the prostate in men. In ladies, a mammogram for the breast, a pap smear for the cervical cancer, and to detect menopausal issues, hormonal tests are as important as the other tests. So in conclusion, preventive health checkups can be extensive, can be limited. We have cancer markers in the blood test which can detect specific cancers. CEA, for example, carcinoembryonic antigen, is a test for cancer of the large intestine. CA19-9 is a blood test we do to detect cancer of the pancreas. So in conclusion, a lot of tests and a lot of options are available for men and women to pick up problems early. Thank you.